Thank you very much, Mr. Manfred. First of all, I would like to say that I'm a little frustrated because I would like to be present in the other sessions discussing the problems and solutions for Africa, for Asia, and for high-income countries. But unfortunately, I don't have a clone yet. I did. But in our session, we presented experiences and perspectives from Latin American Caribbean experts. From Argentina, we presented how the country has advanced regarding to the goals set by the World Health Organization in the document on the Global Strategy on Diet, Physical Activity, and Health. She showed us the problem of prevention of infection in Argentina that has contributed to the decrease of the risk of cardiovascular disease in the country, interaction by educational campaigns which contributed to the consumption of healthy foods free of trans fatty acids. The challenge now are optimizing foods, working with the agriculture sector, industry, and educational institutions. Peru, the country identified potential levers for agriculture from the public health perspective. The urbanization of population, which caused a series of diseases, the creation of indicators for monitoring success of the measures, and he concludes that the majority of public health professionals may be more familiar with the demographic and epidemiological transitions than the nutrition transition. From Brazil, we could see what has been doing in the last decade to fight against poverty. How works the Hunger Zero strategy in Brazil? Some of the most important food and nutrition security policies include improving coverage and quality of primary health care through family health teams, redistributing income, especially through cash transfers programs, as the Bolsa Familia program, which allows the access to food to basic social rights as health and education, stimulation of local agriculture, mostly through home-grown production, and the school feeding program, which covers more than 47 million students for free, and much purchase of the school feeding program, at least 30%, must be, have been from foods produced from local producers, small producers. He concludes that policies like education, agriculture, health, and social policies must be articulated and strengthened in order to focus their efforts and multiply their incomes, their outcomes, with strong monitoring and evaluation systems which can subsidize all sectors and stakeholders in policy and decision making. We also learned about the regional level and the framework of the Central American Integration System, initiatives, strategies, and policies that have been adopted in Caribbean with the participation of different sectors, including health, agriculture, education, and environment. The technical cooperation and assistance activities that are undertaken in the 8 member countries, Guatemala, Belize, El Salvador, Costa Rica, Nicaragua, Honduras, Panama, and the Dominican Republic, include support for the formulation, implementation, and strengthening of national programs and multi-sectoral health, agriculture, social protection, education in the private sector, and interdisciplinary national commissions to reduce chronic malnutrition. Within this, the final considerations of our session are that most poor people in the world feed their families and earn their income from farming. When farmers increase their productivity, nutrition is improved and hunger and poverty are reduced. We must respect regional cultures, habits, climate, and foods, and the specific nutritional requirements of the populations, and improving access to healthier foods like fruits and vegetables. Policies like education, agriculture, health, and social policies must be articulated and strengthened in order to focus their efforts and multiply their outcomes with strong monitoring and evaluation systems, which can subsidize all sectors and stakeholders in policy and decision making. Policies based on the Brazilian experience, like Hunger Zero strategy, that improves cash transfers for poor families that must have children in school and keep their vaccinations up to date. These children receive school meals that are provided by the state, and the state must buy the meals produced by small farmers, which in turn are able to feed their families, consuming goods, and boost the local economy. This is a virtuous cycle. Well, Albert Einstein used to say that if you always do the same things, you always will have the same results. So, if we want different results, we may change. I think that the circumstances have led the world to a critical decision. Either we begin now to work in a new perspective, or, unfortunately, it will be too late. Thank you very much.